Good afternoon, everyone. We are so glad that you are here with us today. It is right at 12 o'clock, so we will go ahead and get started. We're very excited and thankful that you took the time out of your midday today to come and chat with us for a few minutes for the first part of our vaccination series, Myths and Facts about COVID-19 in Children. So we are Mecklenburg County Public Health Department. Today, we're going to be talking about kids and the COVID-19 vaccination. Wanted to let you guys know up front that we are always available to answer your questions. We have a public hotline at 980-314-9400, and we have hotline representatives from the health department available to answer your questions in English and in Spanish Monday through Friday from 8 a.m. to 5 p.m. Please spread the word about this COVID-19 hotline. You will get to a warm body. You will not get to a recording, and we are here to help you. To start out with today, my name is Autumn Watson. I'm one of our senior health managers in our COVID-19 unit with Mecklenburg County Public Health. I have with me today our COVID-19 epidemiologist, Darian Woods, who will be presenting some data during the slide presentation. We have Gwendolyn Devens, who is a health manager in our COVID-19 unit. We have Megan Alawali, who is a health educator in our COVID-19 unit. Shakitha Wright-Graham, another health educator in our COVID-19 unit. And then Michelle Partridge-Doer, who is our communication specialist extraordinaire today. So as we go through this presentation, if you guys have any questions, please be sure to utilize the Q&A feature of this webinar. Unfortunately, we do not have access to the chat feature. If you post any questions in the chat feature, there is a glitch in the system that will not allow us to see all of them. So please utilize the Q&A feature throughout this presentation, and we will tend to your questions throughout the presentation, and we'll also have an area at the end to answer additional questions. There is so much stuff about COVID-19. How do I know what information I can trust? This is a quote that has come from a parent of a Charlotte Mecklenburg School second grader. And this is what we hear so often from parents, caregivers, and teachers when it comes to COVID-19 and children, specifically when it comes to vaccination. COVID-19 has been with us for the last couple of years and we don't see it going away, but there are also so many different opinions and so many different sources of information where parents and caregivers are getting COVID-19 vaccination shot at them from all different sides. It's really difficult to be able to navigate through and get your questions answered. And so that really is why we're here today, to help sort through some of that information that's coming at you from all angles. A little bit about what we will cover today. So we will cover up-to-date COVID-19 statistics. This is going to be specific for kids living in Mecklenburg County. So why this webinar is a little different than others you may have been on. We will not cover statewide statistics. We will not cover national statistics or worldwide statistics. We really will be bringing you in each part of this webinar series statistics for children in Mecklenburg County as recently as this week throughout our communities here in Mecklenburg. Next, we'll talk briefly about COVID-19 vaccine safety in kids. So throughout this series of webinars, it's a 4-part series, we will be talking about the different myths and miscommunications and facts regarding COVID-19 vaccination in children. This week's webinar is going to be on vaccine safety in children. Number 3, we're going to talk about the different COVID-19 shot options and help to clear up some misconceptions there and really give you the low and dirty information on exactly what's approved, where you can get it, and what your kid would be eligible for. And lastly, where parents and caregivers can find trusted information. So that trusted is bolded and underlined for a reason. We understand that information comes from all areas right now. I'm a parent of 2 elementary and middle school age child myself, and know that we get so much information as parents and caregivers surrounding not just our kids, not just about COVID, but about kids and COVID. And it's really hard to muddle through sometimes. So with this, I'm going to pass the mic over to Darian to go through what does COVID-19 look like for kids right now, specifically in Charlotte and surrounding communities.
Hey, can you hear me?
Yep, I can hear you, Darian.
Perfect. So we will go into the children COVID-19 cases for Mecklenburg County. So for Mecklenburg County, we saw just over 3,900 cases in children during these past 2 weeks. This is down 67% from the previous 2-week period. And during January 10th to 23rd, where here in Mecklenburg County, we saw our peak in cases, we had just over 11,815 cases among children. In all, children under 18 accounted for 25% of the new cases here in the previous past 2 weeks. And to give some perspective on this percentage, overall in Mecklenburg County, we have about 23% of our total population of children. So we are seeing a slightly higher representation in children in our total cases. But during the Delta peak, we saw just over 30% of all of our total cases going to children. And here in this graphic, we show all the children cases from the start of the school year. And this really puts into perspective how substantial this past surge was compared to the start of the year, where we are experiencing the Delta wave. And fortunately, with this latest surge, we are seeing a significant decreasing number of cases. And these cases are coming down at a faster rate than the Delta surge. And then moving on to COVID vaccinations here in Mecklenburg County. Since beginning of November, children here, 5 to 11-year-olds, have been able to receive their COVID vaccination. And as of this week, 32% of 5 to 11-year-olds have received their first dose, and 26% have received their second dose. And this is just for Mecklenburg County. And with those 26% who've received their second dose, they are now completed with their primary vaccine series. On the other hand, children 12 to 15 have been able to be vaccinated since September, and even earlier for children 16 and 17-year-olds. And among this population, 12 to 17, we have almost 60% who have received their first dose. And with this, overall, we have an estimated around 103,000 kids 5 years and older who have not started the vaccination series. And this shows that we have opportunities to increase our efforts to get kids here in Mecklenburg County vaccinated. So I will be passing it back over to Autumn, who will continue with the myths and facts around the COVID-19 vaccinations.
Awesome. Thanks so much, Darian, for that information. Now that we know what's going on in our area with children and COVID-19, specifically in the last couple of weeks, let's talk about the COVID-19 shot itself. The biggest question we get, short of how do I sort through this information, is are COVID-19 shots safe? Parents and caregivers want to do what is best for their kids, always, but they have a lot of questions first, and we recognize that 100%. A little bit about COVID-19 shot safety. So doctors and scientists agree that COVID-19 shots are safe. Safety is a top concern and was studied a lot before shots were allowed to happen. Thousands of kids participated in trials over the last couple of years, so scientists could study the shots before they were authorized. So parents and/or children opted into clinical trials over the last couple of years for months and months and months so that scientists could study the effects of the COVID-19 shot in children. Now, one big question that we get is, well, children weren't approved until later. That's because we don't typically start with children in these trials. We start with adults. So that is why adult vaccinations were approved before the childhood vaccinations. The studies began in adults. So adults were allowed as of December of 2020 to start receiving some vaccinations for COVID-19. Children were not authorized until later last fall for the younger age groups, and adolescents weren't authorized until the summer. That's because we wanted to make sure that the study and efficacy in vaccinations for COVID-19 were studied good and hard before it was authorized for kiddos to start getting these. Another big question that we get is about mRNA. mRNA is short for messenger RNA, and this is what is in the COVID-19 Pfizer shot. So the reason that we're highlighting mRNA is because the Pfizer shot is the only vaccination for COVID-19 that has been approved in children ages 5 to 17 years old at this point in time. A lot of misconceptions surround mRNA in that it is new. It's a new vaccine. This is a new type of vaccination. But in reality, mRNA isn't new at all. And scientists have been studying mRNA for use in vaccines since 1990, which is over 30 years of research. So as a parent or a caregiver or a trusted family member, how do you know the shot is safe? It's a lot to say that the shot is safe, but how can I prove that the shot is safe? What reference material can I look at to know if it's truly been studied for safety? So in the United States, the Food and Drug Administration, or FDA, performs safety checks. The Centers for Disease Control and Prevention, or CDC, additionally performs safety checks. And all of these are done throughout ongoing clinical trials that start way before vaccinations are able to be authorized for use in individuals, especially in children. And so these are researchers. They're studying every aspect of the COVID-19 vaccination from the second that the smallest dose goes into an arm all the way through larger doses to get the minimal amount of dose with a maximum effectiveness. That means what's the smallest amount of a vaccine that we can give somebody, especially a kiddo, to be able to give them the most immunity that we can safely. So how was safety reviewed for these, you might ask? It was tested for safety in thousands of kids before recommending. The United States has some of the most strict safety monitoring in the world, but additionally, right now in the year 2022 and in 2021 and in 2020, we have the most strict safety monitoring in the entire history of the United States. So many people have gotten vaccinations as an infant, as a young child, as an adolescent over the course of the last 100 years. And right now, we have the most strict safety monitoring in place than we've ever had before. Lastly, no serious safety concerns were identified for the outcomes of the clinical trials, which then led to the authorization of these vaccines to be used in children. As of today, in the United States, over 25 million kids have gotten the COVID-19 shot so far. That is a massive number of children in the United States, and these kiddos are fully vaccinated, partially vaccinated, and able to go about as normally as possible as we are going through this COVID pandemic still. So which COVID shot does my child get? Again, this comes down to there's lots of information surrounding different ages and different times. So we're going to break this down a little bit for you. If your child is between the ages of 5 years old and 11 years old, they are currently authorized to get the Pfizer vaccine, which is more commonly just known as Pfizer. This vaccine is going to have 2 doses total. So your kiddo would get their first dose, they would come back 21 days later or around 21 days later and get their second dose. For kids who are ages 5 to 11 years old, this is a smaller dose than in teenagers and in adults. So through these clinical trials and through studies, scientists were able to show that in our kiddos, their bodies are smaller, and a smaller dose works just as good for them as a larger dose in adults. So they do get a smaller dose currently authorized in the United States. So we get the question a lot, 2 doses total, but some kids get 3 doses. How do I know if my child should get 3 total doses or not? Well, currently, children with compromised immune systems in the United States might get a total of 3 shots. Compromised immune system examples are children who are going through chemotherapy treatments, or they have undergone an organ transplant and they're taking anti-rejection medication. If you have any questions about compromised immune systems, or if your child has a compromised immune system, we encourage you to talk with your child's medical provider. The reason that some children are offered 3 doses is because their bodies have, because of their compromised immune systems, their bodies are not creating antibodies as good as someone who doesn't have a compromised immune system. So sometimes they need that extra 3rd dose to jumpstart their bodies to create those antibodies after a vaccination. So our next age group up is the 12 to 17-year-olds. So these are going to be your adolescents. They are currently approved for the Pfizer vaccine. They additionally get the same 2 doses, so dose on day 1 and then another dose on or around 3 weeks later. This dose is the same as adults. For those of you that are parents or caregivers of 12 to 17-year-olds, these kids are bigger. They're bigger than your 5 and 6 and 10-year-olds. These kiddos are closer to adult size, and they have been studied vigorously in clinical trials to make sure that an adult dose is what they need in order to adequately protect themselves against COVID-19. So the same rule with kiddos that are younger with the compromised immune systems goes for adolescents too. If they have a compromised immune system due to medications or therapies that they're undergoing, they may need 3 shots for that first series instead of 2. And if you have questions about that, again, please consult your child's medical provider. So lastly, we've got ages 12 to 17-year-olds listed again. Why do we have that? That's because in the United States, currently kiddos age 12 to 17 are recommended a Pfizer booster dose. So this is an additional shot after 5 months. So once they receive their first sets of doses, which are going to be those first 2 or 3, they are eligible for a booster shot after 5 months. Children with compromised immune systems may get a booster 5 months after their 3rd shot. So they might end up with 4 total doses rather than 3. So let's talk a little bit about the primary series and the booster dose and what that means. So the primary series is that initial round of shots given 21 days apart. So whether you're getting 2 shots or you're getting 3 shots due to a compromised immune system, the primary series is talking about that initial round of shots. A booster dose is a dose in a series that is given to reboost the immune system after the immunity starts to wane over time. So this is going to be similar to our annual flu vaccination. We receive flu vaccinations every year because throughout the year, our immunity against strains of the flu wanes from that initial series. With COVID-19, scientists have found that that also occurs in waves. So a booster shot is recommended in order to stay up to date on your COVID-19 vaccinations. Currently, boosters are not recommended for children under 12 years old. For that 5 to 11-year age group that was just able to start getting vaccinations back in the fall, they are not currently authorized for or recommended for boosters. But we'll be keeping a close eye on that to see if that's something that comes out in the next couple of months. So just to reiterate, as of today, which is February 10th, in case you're watching this later, kiddos under 5 are not authorized to receive COVID-19 boosters or COVID-19 shots in general. I'm sorry, I misspoke. Right now, only kiddos age 5 to 11 are authorized for COVID-19 vaccinations. So if you have a 1-year-old or a 2-year-old or a 3-year-old, as of today, February 10th, those kiddos aren't yet eligible. But there are trials that are continuing to happen right now to study safety for kids younger than 5. And we will definitely be keeping our eyes and ears on the FDA, the CDC, and those clinical trials to see a closer time frame of when those shots will be authorized for our younger vulnerable kids. All right. So now that I know what's going on with kids in my area with COVID over the last 2 weeks, how the shots have been tested for safety, what shots my child should get and when, where do I go for information that I can trust? So some areas that you can go for information that you can trust are your doctor or your child's doctor. Make an appointment, make a phone call, ask your doctor, ask your child's doctor. If you are in a network of physicians that has an online portal, send them a portal message. You can also always go to your local health department with questions. We have that hotline number that is set up, that 980-314-9400, option number 3. That is an area where you can always call Monday through Friday, 8 a.m. to 5 p.m. and ask your questions. And if we don't know, we will work our hardest to find out an answer for you and get back to you. You can go to the North Carolina Department of Health and Human Services website or give them a call. You can also visit the FDA website or the CDC website. Those are trusted areas of information where factual information will be posted. Sometimes we like that information, sometimes we don't like that information, but we can always trust that we're going to get accurate information from these sources. So let's talk a little bit about places that are not necessarily good places for trusted information regarding COVID-19. So not good are social media and opinion websites. These days, social media is very a large way that we get our information and our communication. Unfortunately, social media is fraught with biases for all different types of things, whether they be something that you agree with or something that you disagree with. You can pretty much find individuals that will back any way that you choose on social media, which isn't always the best place to find trusted information and accurate scientific information. Additionally, opinion-based websites. So we see a lot of information that is circulated through websites that are opinion-based. So again, whenever you search on the internet, most of the time you can find something to back whatever opinion that you have, whether it be accurate, inaccurate, good, bad, or not objective or non-objective opinions. You will be able to find them on the internet. So please be wary of social media and of opinion websites. So some other areas that can be trusted, but we ask you to use caution and or verify this information are TV news and media stations, additionally newspapers. Also, would like to mention family and friends, circles of peer groups that you have. A lot of times you can get great information from these sources. Sometimes you also have to verify if that information is accurate or not. Word spreads by mouth a good bit, and sometimes if you've ever played the child's game telephone, what starts out as a message that may be accurate gets translated over and over so many times that it may have some inaccurate pieces to it. So you always want to make sure that you use caution and you verify information that is coming from TV news media and media stations that are coming out, as well as the newspaper. All right, so we have gotten about 25 minutes into our presentation in this webinar and would like to see what questions that you have that we can hopefully help to answer during this webinar.
At this time, there are no questions in the chat.
Fantastic, thanks so much. So we do have an upcoming vaccination clinic on Friday, which is tomorrow, February 11th, 2022, from 3 p.m. to 6 p.m. at Star Mount Academy. Each of our webinar series, we will post any upcoming vaccination clinics that we have at our CMS schools around Mecklenburg County. You can also always visit our website, which is mecknc.gov/COVID-19. If you get somewhere and you don't quite remember our website, if you go to any search engine, so Google, Yahoo, you can always just type in Mecklenburg County Local Health Department, and it'll be the first website that pops up, and navigate very easily to our COVID-19 page. Once again, you can call us. Our Mecklenburg County COVID-19 hotline is staffed with bilingual staff, English and Spanish, Monday through Friday from 8 a.m. to 5 p.m. And you can reach us by calling 980-314-9400, option number 3 for English and option number 8 for Spanish. All right, and that is what we have for you today. So we really appreciate your time, you taking the time out. These will be recorded and they will be available on our website for later viewing. So if that is something that you're interested in, please navigate to our website. We will be meeting right back here again in 2 weeks on the 4th Thursday of February at 12 o'clock on February the 24th for part 2 of our COVID-19 in children vaccination question and answer and webinar. Hope you have a wonderful day. Thank you.